In early May 2026, the medical staff aboard the MV Hondius faced a sudden, severe respiratory outbreak. The ship had departed from Argentina and was navigating a remote itinerary across the South Atlantic Ocean toward Cape Verde, putting the vessel hours, and sometimes days, away from any major medical facilities. Out of the 147 passengers and crew on board, 8 people rapidly developed severe symptoms. Within a matter of days, 3 of those patients were dead. News of a deadly respiratory illness sweeping through a quarantined cruise ship hit the internet immediately. People began searching for details on human-to-human transmission, worried they were watching the prequel to another global lockdown. The settings certainly tapped into our collective pandemic anxiety, but the biological reality of this specific pathogen tells a strictly localized story. Laboratory testing conducted in South Africa quickly confirmed the culprit. The passengers were infected with a Hantavirus, specifically the Andes strain. Hantaviruses have an exceptionally long silent incubation period, sometimes taking up to 8 weeks before the host shows any symptoms. That massive delay is what allowed the infected passengers to carry the virus across international waters completely undetected. Despite the terrifying setup, this event is not the beginning of the next COVID-19. The biological rules governing hantaviruses are distinct from the highly contagious pathogens we are used to. To understand why the cluster on the Hondius is such a biological anomaly, we first have to look at how 99% of hantaviruses actually function. Around the world, hantaviruses are carried primarily by wild rodents, like the deer mouse shown here. They act as natural reservoirs, carrying the virus in their systems without ever getting sick themselves. The virus is shed in the rodent's urine, droppings, and saliva. Over time, that waste dries out and breaks down in the environment. Infection happens when a person disturbs those dried droppings. Sweeping or walking over the debris launches tiny virus-laden particles into the air, where they are easily inhaled into the human respiratory system. Because that exposure is so brief, maybe just a few seconds spent cleaning out an old barn, and the incubation period lasts for weeks, it is incredibly difficult to trace exactly when and where a patient was exposed. When symptoms do finally surface, they start as simple flu-like fatigue, but they quickly progress to hantavirus pulmonary syndrome. As we see in this cross-section, the virus attacks the lungs, causing capillaries to leak and the alveolar spaces to rapidly fill with fluid. For the vast majority of hantaviruses, the biological cycle stops right there. The virus jumps from the environment into a human, but it lacks the genetic machinery to jump from one human to another. The passengers on the Hondius didn't catch the virus in the middle of the ocean. Their journey began weeks earlier in Ushuaia, Argentina. Ushuaia sits within the natural range of the Andes virus, a specific strain found only in South America. This May 2026 European Center for Disease Prevention and Control brief outlines the Andes virus is the only hantavirus capable of direct human-to-human transmission. But as highlighted here, the virus is inefficient, requiring intimate, prolonged contact, or direct exposure to bodily fluids to find a new host. When it does successfully infect someone, it is exceptionally dangerous. In an outbreak setting, the Andes virus carries a case fatality rate ranging from 20 to 35%, and sometimes higher. The layout of a cruise ship provided the exact physical catalyst this sluggish virus needed. Enclosed dining halls, shirred cabins, and tight quarters artificially forced the prolonged contact required for the virus to spread among the passengers. This outbreak represents a rare spatial coincidence, an environment that artificially bridged the gap for a virus that normally struggles to move between people. We can see the stark difference in risk when we look at this data visualization comparing transmission rates. While a highly adapted respiratory virus like SARS-CoV-2 exhibits explosive, multi-branching spread, the Andes virus creates an isolated, single-branch transmission chain that quickly burns itself out. Because it struggles to spread casually, both the World Health Organization and the CDC consider the hantavirus risk to the general global population to be extremely low. Public health authorities track down close contacts from the ship because the mortality rate is high for those directly exposed, not because they are bracing for a global wave of infections. Worrying about catching a hantavirus from a coughing passenger on your next international flight is directing your anxiety at the wrong target. The actual threat is located much closer to home. Protecting yourself against a hantavirus infection means dealing with rodent infestations in enclosed, poorly ventilated spaces, like your garage, a seasonal cabin, or a storage shed. If you find mouse droppings, there is one absolute rule you must follow. Never dry sweep or vacuum the area. Doing so instantly aerosolizes the dried waste and weaponizes the virus. Instead, follow the CDC's wet cleaning protocol. First, open the doors and windows to ventilate the space for 30 minutes. Then put on rubber gloves and completely soak the droppings with a household bleach or disinfectant solution. Let the chemicals sit for 5 minutes, then wipe up the soaked debris with paper towels. Double bag the waste in a sealed garbage can and wash your gloved hands with disinfectant before you take them off. Basic scientific awareness and a bottle of bleach can neutralize a deadly environmental threat that global travel protocols simply aren't designed